Hi everyone, welcome back. So today I am going to be talking about another issue that can be helped by massage therapy, which is psychosomatic illness and pain. Now you may have already seen my post on chronic pain and the pain cycle. So the information in that video will actually be quite strongly connected to what I'm going to talk about today. So if you haven't already looked at that one, take a look. So when we talk about psychosomatic illness, quite often people think that it's not really a big issue. It's just something that's, all in the person's head. It's basically made up. And so therefore they think, well, it doesn't need any treatment. But actually what it does mean is that there is a very real physical problem, which usually is or becomes a chronic problem. But it can be either caused or certainly aggravated by psychological and emotional factors. Basically, anything that produces stress. So yeah, in basic terms, it's where stress of some description manifests itself in the body as a physical symptom. There are problems in terms of seeking treatment, though, for these chronic issues, and this is for a few reasons. Firstly, if you are able to actually access treatment, quite often it may be that you are receiving either incorrect or incomplete treatment, because there's still very much a sort of a lack of understanding and a lack of recognition, that many chronic pain issues are caused or worsened by psychological factors. And so what happens is that, even in the medical profession, a lot of, professionals then treat the physical pain, because that's where the symptoms are, but they're not actually addressing the root cause of the problem. And so what this then means is that, the long-term chronic pain patient often ends up on various pain medications because that's what's being used to treat the physical symptoms. And because it's not, treating the root cause of the problem still persists. And so then they take more painkillers. They then can't do without them, because they've become quite often physically dependent on them. But the psychological issues are still there and still causing symptoms because they've not been addressed. And so this is where the chronic pain cycle comes in, which, as I've said, I've discussed in the previous video on chronic pain and the pain cycle. So take a look at that. So what happens is that then, because, they feel like they're having treatment, but it's not resolving the situation, it's still there, they're getting worse. What happens is that their stress levels then increase further. And this, of course, then makes the problem worse again. Another reason why treatment is difficult is that quite often treatment, there'll be a delay in even accessing any kind of treatment. And this is for two reasons. Firstly, there is still very much a social stigma attached to mental health and psychosomatic illness. And so this can actually prevent people from seeking help. It can also be delayed really due to just that lack of understanding of the effects of stress on the body. And people quite often will just think, oh, well, it's just a little niggly ache or something, and they don't really relate, the physical symptoms to what's actually going on in their life. So we're going to look at the causes of psychosomatic illness. So obviously we know in basic terms it's stress. So this could be stress, quite often due to grief or bereavement, some sort of big life change. It could be something like maybe a divorce, very stressful divorce, or I don't know, redundancy that then has a knock-on impact on other areas of your life. It could be if you have, if you're someone who just has an inability for whatever reason to vent emotions and to be able to express yourself, so you hold everything in, eventually you're going to reach a breaking point, and all that stress has to basically be released somewhere. People who have, a long-term history of depression or any kind of chronic stress, such as PTSD, which is obviously due to some sort of trauma. So basically, it's anything where there are high levels of stress or long-term stress. And what this does is it actually can weaken the immune system, which then increases the likelihood of developing physical symptoms. Now, one of the things we mentioned there was about if someone's had, a history of PTSD, which of course is usually related to trauma or abuse. Now, research has actually shown that there is very much a link between abuse and psychosomatic illness. It's thought that about 40 to 60% of women and at least 20% of men with chronic pain have a history of being abused. And the incidence of abuse is certainly between 2 and 4 times higher in the population of chronic pain patients than it is in the general population. So there's definitely, a link there. Also, those who have suffered either very severe, very frequent, or sexual abuse are more at risk of developing symptoms such as PTSD, also fibromyalgia, and I've also done posts previously on both of those subjects, so they're also worth taking a look at if these things apply to you. And these sort of syndromes are, characterized by an increased use of medical services, dysfunctional behaviour, and also a need for validation, a need to have some kind of explanation for all of these, physical symptoms that are, making themselves known. But the problem is that often people who suffer with these, will continue to repress painful emotions and memories due to the trauma or abuse. And this then, kind of perpetuates that cycle of, the behaviour and the physical symptoms and everything else. Research has also shown that, there are physiological changes in the brain tissue and brain patterns of those with PTSD, long-term depression, bipolar, fibromyalgia, and a history of abuse. So it's actually thought that this is why people with these syndromes and with these types of medical issues actually have an increased pain perception, which of course makes the likelihood of being a chronic pain patient quite a bit higher. Okay, so if we look at what sort of symptoms are most common in those with psychosomatic illness, we're looking at things like, shoulder and back pain and tension in these areas, which, anyone knows, when you get stressed, these are often the first areas where you're going to feel, that you're stressed. But also stomach problems. Certainly, those of you with IBS will know, quite often stress will really kind of bring out those symptoms. Headaches, migraines, it could be pain during intercourse, and certainly in cases where there has been a history of sexual abuse, that would certainly be apparent. Pain during menstrual cycles, maybe a fast heart rate, sweaty palms, those sort of outward kind of symptoms that, show that someone may be stressed. There's certainly a difference in sort of the main type of symptoms depending on whether you're male or female. Women certainly seem to experience more in the way of abdominal bloating and menstrual changes, and this, obviously is going to be down to, the hormones. And also it's quite common for women to experience a lot of fatigue, even if they've had a good night's sleep. Whereas men, on the other hand, generally tend to exhibit more symptoms like chest pain, high blood pressure, and reduced libido. For children, children will certainly often display physiological symptoms of stress, and this is really because they're not at an age where they feel kind of able to really communicate how they're feeling, and so it kind of builds up, in a physical sense, and I'm sure, a lot of us sort of know of a child maybe who has been bullied at school, and then, when it's sort of time to go into school and they're getting stressed, and then they complain that they've got a stomach ache. And so this is a form of psychosomatic illness. For teenagers, it's a little more difficult, and this is where the signs of stress and depression in teenagers will often be missed, and then it builds up and becomes a chronic problem. And this is because obviously the teenage years, lots of changes taking place. There's major social adjustments, there's hormonal shifts, a lot of mood swings and things. And so quite often, depression and things that can really, be one of the leading factors in psychosomatic illness will be missed because it's just put down to them being a teenager. And, for elderly people as well, certainly they are more prone to depression. And this is really because, they tend to experience more loss and grief, of sort of friends around them of a certain age, being more prone to chronic health problems, and reaching, end of life. And they can feel, much more isolated, and then, depression kicks in. So, and as we've said, any form of stress, if it's prolonged or severe, will lead to a compromised immune system, which will result in, as we've said, infections, catching infections really easy, catching colds, when you get ill or hurt, extended recovery times. And it can also affect those things. We've talked about the effect on of stress on abdominal pain and IBS, things like that. Sometimes IBS can also be an immune problem as well. So in terms of treatment, how do we treat it? As we've said, treatment can be quite difficult, and quite often it can be delayed, through social stigma or just a lack of understanding, even in professionals. So in order to seek appropriate treatment, effective coping mechanisms to manage your stress levels have to be identified. Now, there's a whole range of things, that could be used as a coping mechanism. I believe massage therapy is one of the best ones, because this will address both physical symptoms and the stress itself, whereas a lot of other therapies will only focus on the physical issue or the mental health issue. But certainly there are other things, support groups, relaxation techniques, regular exercise, nutrition, and various other things. But alongside finding these, coping mechanisms, it's also important to eliminate any unhealthy coping mechanisms that you have been using. So this could be things such as high alcohol consumption, which obviously is also, if it becomes a long-term thing, will also negatively impact on your physical health. But also, it's important to learn how to express yourself better, so that you're not kind of holding all this stress in. Find some way, to just vent, and release that stress. Surprisingly now, anti-inflammatories can be used as a treatment. Obviously they can be used for pain, but actually the main reason why they may be used is that stress can overload the body with chemicals that actually produce inflammation in the muscles, causing pain, and particularly around that neck area. So it may be that anti-inflammatories will help. Now, there should also be certainly consideration by the person themselves and by any medical professionals involved of past or present abuse or any other trauma. So that could even be trauma sort of with regards, for example, to military personnel, who of course again are going to, there's quite a high incidence of PTSD. There also has to be some empathy from, any professionals that are sort of involved in treatment, and constructive validation of both physical and the psychological issues, and a recognition of maybe of dysfunctional pain patterns, and also the personality traits, and these sort of patterns that we see that come with, maybe PTSD or bipolar. Any physiological and non-physiological features that are noted during a medical assessment should be documented. It shouldn't just be a case of any physical symptoms. There has to be a record of these other contributing factors. Multidisciplinary treatments are also a good idea, involving psychotherapy or holistic treatments if they're indicated. It shouldn't just be about attending a chronic pain clinic and being put on, some form of pain medication. And as I've said, the bonus of massage is that it helps with the physical symptoms and deals with the stress as well. So it actually hits that psychosomatic illness from both sides. And so if you're not going to be doing something like that, then the bonus of having a multidisciplinary team is that, hopefully in that way you will be, sort of getting treatment for the physical symptoms, but also to deal with the stress. And really, any professional should be offering you alternatives to medications that could potentially be habit forming, if it's possible. So, quite often I've seen sort of chronic pain patients and they're on, morphine and amitriptyline and, so many different things that are really heavy going medications, and they end up, just addicted. And they're not always essential. There are sometimes other things you can try before getting to that stage. And really, the other thing is to just help, you should be receiving some help with understanding the relationship between any abuse or trauma and the physiological symptoms, in the hope of being able to reduce, use of healthcare services and being dependent on painkillers, etc. So they're really the things that you should consider if you have some form of chronic pain issues, psychosomatic illness. Certainly, as I've said, if you do have any kind of chronic pain, PTSD, fibromyalgia, I've done previous posts on these, so just take a look at those because they will be more specific to you and your issue. But yeah, so that's really all for now. So feel free to comment down below, ask any questions. You can contact me through my Instagram or Facebook pages with any questions, and I will do my best to answer you. But for now, on this subject, that is all for today. So I will see you next time.